Hello everyone, welcome. I'm Dr. Motahare and in today's talk, we will dive deep into the brain fog. Brain fog is something that everyone experiences at some point in their lives. But what is brain fog really? If I told you that brain fog may be more than just you're tired? Maybe your body is trying to send some signals to you about your whole health. This is not about any magic pill or quick fixes. Okay, we'll uncover the fascinating science behind the brain fog and understand why sometimes it's like that our brain is working on dial-up. I'll give you insights that could change the way you think about mental clarity. Let's unpack the mystery together. Let's make it real. Have you ever walked in a room and completely forgotten why you were there? It happens to me a lot. Or try to focus on work, but your mind kept drifting. Or maybe you had a thought in your head, but you cannot make the words, you cannot find the word that you are thinking about. Okay? This is the brain fog. And it sounds familiar. We are not alone. Everyone has these experiences. Actually, brain fog isn't an official medical diagnosis. It's a term which is used to describe a group of symptoms, such as trouble concentrating, memory lapses, feeling mentally tired, or thinking more slowly than usual. So instead of being a disease, brain fog is more likely your brain way of saying, hey, something is off. Okay, you should listen to that. So, what actually is happening inside your brain when you feel foggy? It often comes down to disruptions in the brain chemistry and communications. Neurotransmitters, which are brain's chemical messengers, may be out of the balance. Inflammation can also slow down how signals are processed. Hormonal issues can interfere with brain function, like menopause or uh, PMS, okay, or in pregnancy. And if your brain isn't get enough oxygen or nutrients, it wouldn't run as efficiently. Think of this in this way: that your brain uh, is like a weak Wi-Fi. Your brain is connected, but it's lagging. Brain fog isn't always mysterious. It triggers by things that we can control. One of the most important one is lack of sleep. Your brain needs rest to clear out waste. When we don't have enough sleep or quality sleep, the result would be brain fog. The brain is tired. A poor diet, rich in sugar and processed food, can uh, increase the inflammation, fuel the inflammation. And also, most importantly, chronic stress. Chronic stress can lead to brain fog because of um, elevated cortisol level. All the time, cortisol level is high. So everything is down. Okay. On the other side, some kind of nutrient deficiencies can lead to brain fog, hormonal changes, and certain medications. Uh, it's also important to notice that brain fog is sometimes significant and persistent in patients with autoimmune disorders, okay, like arthritis rheumatoid or lupus or all the autoimmune disorders, and also post-viral conditions, like things that we saw during the COVID, long COVID. The good news is that you have the power to fight back, at least some part of that. Let's talk about the healthy lifestyle. Aim for 7 to 9 hours of quality rest. Very important. Then focus on nutrition. Your brain thrives on whole foods. I explained about it a lot in my previous videos. Think of it like as fueling a high performance engine. Stress management is key, but because I'm not good at this, I'm not going to talk about that. Just find a way to manage your stress. And don't underestimate the power of movement, exercise. Daily exercise is very important. Even a short walk can make a big difference. And lastly, stay hydrated. Very important for all parts of health, including brain fog. It's a simple step, but so critical for your brain optimal function. So when we should seek help, occasional brain fog is normal, but sometimes it's a sign of other um, medical conditions that need attention. If your symptoms last for weeks or months, or it interferes with your daily life, or it comes with other symptoms like headache, weakness, confusion, it's time to see a doctor. And if you have already a chronic condition like diabetes or thyroid problem or an autoimmune disorder, a persistent brain fog should be definitely checked. If you have any chronic problem and you have persistent brain fog, you should see a doctor for sure. Prevention is always better than treatment. Make rest and recovery a priority in your routine. It's very important. Sometimes we need rest. We need to relax. Do not do anything. Keep a consistent daily schedule to reduce stress in your brain in a way that you can find it. And challenge your mind with mental fitness activities like puzzles, reading, or learning something new. Stay physically active because exercise supports your brain health. And most importantly, build resilience to stress because mental clarity thrives when stress levels are under control. To wrap things up, let's review the key takeaway messages. Remember, brain fog is a symptom, a signal from your body. The science shows it's rooted in physiological issues like inflammation and neurotransmitter imbalance. The good news is that we have the power to control the triggers by our lifestyle changes. With a good sleep, quality sleep, good diet, stress management, you can control your mental clarity. And always remember that you should consult a professional if your symptoms are persistent or severe. Thank you for your time and attention today. I hope this presentation has given you a clearer understanding of this often frustrating experience. Your mental clarity is a vital part of your well-being. And by understanding the why behind the brain fog, you can take meaningful steps toward a sharper, more focused view. I'd love to answer any question you might have. Thank you again for joining